We will not copyright or trademark that. We do not have the rights to this at all. Please do not sue us. Thank
you. Welcome to These Unprecedented Gays, featuring Joe Granelli and Paul Smith. Don't forget to like, subscribe, follow, and review wherever you stream your podcasts. Check us out on Instagram at tugayspod and email us at tugayspod@yahoo.com. We hope you enjoy. Hey, all you tuggers and tuggettes. I'm Paul.
And I'm Joe.
And we are These Unprecedented Gays.
We are indeed.
We are. So how was your week, Joe?
So I've been doing a lot of DIYing. I don't know if I talked about this last week, but I am the king of contact paper now, which is like, what do you remember when you were in like grade school and you would cover your books?
Yes.
So it's kind of like that stuff.
Oh, I love that.
But I put it on my cabinet.
Can you
and
make,
on
like,
my countertop,
S's, like the
I did,
rocks
yeah.
S's?
And then you stab yourself with a pencil, and then it's like a tattoo forever. Did you do that?
Yeah.
Okay. So that's been what I've been doing for a long time. It takes a lot of effort because you have to like cut it out, and then you like peel it on. It's like wallpaper,
right? But
it peels off, and so it's like non-waste. If you're a renter, if you're a listener and you're a renter, and you want to like redo your apartment, just get contact paper on not Amazon or go on like
you're like
some
Martha Stewart. Like,
so I will
Bobby
tell you,
Burke
it's exhausting. My back hurt. Like I felt like I ran a triathlon on Saturday because it's like, okay, I got these peel and stick tile backsplash things, and like you peel and you stick it, but then my walls are not.
It
like
sounds like a hip hop lyric. You just peel it and you stick it.
That's like a Missy Elliott. I put my thing down, peel it, stick it, and reverse it. A sure Fleminic dead. Yeah, come on. But it like. You have to peel it and then stick it, but then if you peel it peels off the paint. So then I had to get paint to paint over it.
So all you renters out there, keep that in mind.
Well, yeah. So, okay, this is a pro tip from King Contact Paper Man, me. If you're a renter, find out what your paint color is and go get some before you do it. But if it's Swiss Coffee Industrial, it's really expensive. So make sure you ask the people at Sherwin-Williams for the discount and tell them you're a contractor.
Oh, life hack.
Well, yeah, because my dad does construction, and I was like, well, my dad has he's a construction worker up in the Bay Area, and they're like, oh, okay, that's fine. Because you're like, do you have an account? I'm like, no.
Oh, okay.
I don't have an account. So that's my week. How are you?
I'm good. It's been a crazy week because the girls in the office are getting their second COVID shots.
Ooh, have they gone wild?
I'm like, let me know when you start growing a second head, and like then you can take the day off. But
when did they get it?
They got it this morning.
Uh-oh.
Like, so I'm just like covering for them and stuff, so it's a little crazy. But you know,
they're gonna start feeling it probably right now.
Probably, but ooh. I don't care as long as they don't call in. Are they scheduled to come into work tomorrow? Grace, Martha, and Marissa.
Oh, Grace, Martha. Oh, not GMM.
Yeah, exactly.
Or MGM, depending upon like how bougie you're feeling.
Right.
Isn't that a hotel in Vegas?
Yes.
Okay.
And a movie studio.
Isn't that the Lion?
Yes.
What's the Triangle?
Right.
What's that Triangle Hotel? You're in the hospitality. Okay, I think I stayed there.
Oh, okay. Did you have a good time?
I was in college and I had no money.
And you were drunk most of the time. So
yeah, well, and I was with my boyfriend and we didn't have any money, so I brought like a little grill and we brought food and we cooked in the hotel room so that we didn't spend money.
Burned the place down.
It's fine. Luxor, you're doing great.
So anyway, so we have a special guest.
We do.
In the studio.
I know, that's why we're kind of all like odd because we have headphones on and we're like muffled and they're like really good at noise canceling. But we have like over one ear but not on the other, but it's like canceling it out, and we're just like staring at each other laughing. So listeners out there, you're welcome. We love you and we do this for you.
So we have Dr. Carlton in the studio. How are you?
Hey, it's nice to be here.
Oh, I love that there's a little delay. Like he's all like,
yeah,
like in another state, like on the other coast or something.
But he's in San Diego.
Like he's Anderson Cooper, and we're like, what's the guy's name? Andy Cohen.
Who's Andy Cohen? Oh, the Bravo guy? Bravo Andy? Yeah.
So
I think he has a baby now.
Coast to coast. We're bi-coastal.
Yeah. But we're only on one coast.
Yeah, it's fine. So anyway,
The coast of California.
So, Dr. Carlton, we're here to talk about gay sexual health. So, can you give our listeners a little bit of background about you?
Yeah, sure. I'm a gastroenterologist by training. I basically got into the whole sexual health aspect of things online because of the pandemic. TikTok was my entryway into social media. I never really
Like a gateway drug.
Yeah, exactly. I never really anticipated being where I am today with it, but one day, after being a lurker for about 3 months, I decided to post something, and I'm like, well, what do I know about? Well, number one, I'm gay, and number two, I'm a butt doctor. So, hey, I know about anal sex. Oh, wow. So let's talk about what we know about. Well, so I posted a video on how to prepare for anal sex and how to make it better, and didn't really think much about it. I posted it, and then the next day I woke up to 1.5 million views and like 50,000 new followers. And thought, wow, I've hit a nerve here. So
You're famous. Wow.
Realizing that this was such a big deal, I thought, oh, well, it's just all the gays on TikTok. It's just the gays that are following me. Well, no, it was a lot of straight guys, a lot of women who wanted to learn more about anal sex. So my whole, there I use that word again, whole. My online media presence only grew from there. I'm up to about 167,000 followers on TikTok, and my Instagram's growing. And I never anticipated it to be where it is today, because not only does it reach the gay community, but it reaches straight folks, it reaches third world countries. People in places where you could be executed for being gay or privately message me saying, oh my God, I don't know what I would do without you, because you're teaching me so much that we don't get to learn here. And if we ask our doctors about, we could be turned in and be, sent off to prison or murdered. So who knew that it would be where it is today? But this is where I'm at.
So do you find using TikTok is pretty easy for you? Because I don't do the tiki-taki.
I don't either. It's very difficult.
I can't understand it. But do you find it difficult? Did you find it was an easy medium for you?
Yeah, it's pretty easy. Once you learn a few tricks on how to post things, it gets pretty easy. And honestly, you can post brilliant videos that are artistically done and spend hours and hours and hours and hours on them and get maybe 1,000 views. And then you post a 7-second fart joke and it gets 2 million views. You just never know. So the payoff,
get my view.
Yeah, the payoff isn't always there for the work you put into it. But it's like a slot machine. I think that's how they get you. You keep putting things out there and you hit, and then you keep putting more out there, and then you keep wanting to hit, and it doesn't hit, and it doesn't hit, and just when you become discouraged, something hits again. So, yeah, it's a great medium.
I have a question. Where are you from?
I'm originally from South Carolina.
I knew it. I picked up on the draw.
Yeah, it's there a little bit. A call from mama and a glass of wine, and it comes out really nicely.
I knew.
So we're just going to jump right into the questions, because I know we have quite a few that we sent you and stuff. So the first one is what are the criteria that you give to LGBTQ people about asking about how to find a doctor and the best doctor for them, whether that's a general practitioner or an infectious disease or any other kind of doctor?
Yeah, I think that's a huge issue for a lot of people. A lot of people really struggle to find people that they can be open and honest with. And that's the very critical and key component of finding the right doctor for you. Because if you can't be honest about who you are and what you do, there's a major problem with your medical care. And there are gaps in knowledge in a lot of medical providers who just don't know how to take care of gay people. So I think that it's really important for you to find someone who understands you. Ask your friends. If your friend, do your friends have a great doctor that they're comfortable with, that they trust, that's good? The Gay and Lesbian Medical Association, the GLMA, has a website, glma.org, where you can go and put in your zip code and find a physician that is LGBT friendly based on your zip code. So it's a really helpful resource for a lot of people who live in areas that are not places like San Diego. So I really encourage people to talk to your friends, look at sites like the glma.org website. You need to be able to talk to your doctors. Doctors, like I said, have a lot of gaps in medical education about gay sex. I mean, I never had a class in gay sex, and I went through 4 years of med school, 3 years of internal medicine, and 3 years of GI. So all that training, and we never mention it. It's a forgotten aspect of our healthcare. So you need to find people who know what they're doing, and it's astonishing. I talk to people now who go to their doctors to get tests done, and their doctors aren't doing the right things because they have no clue.
So what are for you, besides asking your doctor, do you suck dick too or something like that? What would be a good question for them to ask their doctor when they're trying to decide if that's the right one for them?
Well, I think it depends on what medical conditions you have, if any, and have a frank discussion with them about, are you comfortable with taking care of a gay patient? Do you understand things like PrEP if you're, looking to get on PrEP, or if you're already on PrEP and you want to get the routine testing that comes with that? If you're lesbian or trans, there are issues that go along with that too, and just making sure that they're comfortable with those issues is really key.
Okay.
So I got really lucky because my doctor's gay. I don't know if you know Dr. Brian Kim. He's at Scripps. You might be best friends because apparently you guys all know each other. So, I mean, like I said, I got lucky, but I think I just stumbled upon it. But my question is going to be really on kind of branching on what Paul was saying is what if you don't have a gay doctor near you? What would you suggest if you feel like you're uncomfortable with your doctor? Well,
obviously that puts you in a quandary. You have to, and it all really depends on your underlying conditions, or underlying concerns. I think it's important to be honest and express your needs, and even ask your doctor if you have a doctor that's assigned to you and you're just kind of stuck with them. Hey, listen, this is what I need. This is what I need you to do for me. We're on the same team here, and I need you to understand this topic and be able to help me with it. And most doctors are pretty receptive to something like that. So if you're in Alabama and you want to go on PrEP and your doctor doesn't understand how to test or look for PrEP, ask them to do some research about what tests they should be doing.
Okay. So you're the butt doctor, so we're going to get right into the butt stuff.
We're going to talk about the whole
We're going to get right into the whole thing.
We're going to crack it open.
So one of my first questions is, what would you tell somebody when they're thinking about tossing salad?
And we're not talking about cooking right now.
Right, exactly. Well,
or we are.
Rimming is what you're talking about.
So scientific.
Yeah. Right.
A very urban dictionary.
That's a technical word for it. Yeah.
He's Nicki Minaj over here. It's fine.
Yeah. So a lot of people are freaked out by it, thinking that it's an unclean thing, or, they're worried if they're going to get some sort of infection from it, or, they're going to automatically get parasites or something like that from it.
Oh my God.
I think it's an important part and an amazing part of sex. I mean, Who doesn't love that?
Okay, I was going to say, what's your opinion on that, Mr. Butt Doctor Salad Tosser?
No, totally. I mean, there's nothing better than, if you're the one doing the rimming, to have the bottom squirming all over the bed, screaming, oh my God, oh my God, oh my God. And there are a lot of nerve fibers down there. It's a rich network of fibers of nerves down there, and just even a light touch. Oh my God. So it feels so good. So obviously the number one thing is you want to make sure that it's clean. Start off in the shower. Start off your date with the shower. If they don't already come over showered, get in the shower.
So you watched
Be Clean.
You watched that show, It's a Sin, right?
Oh, I love that show. Yeah.
And there was that part in the episode, I think the first one, where he's like, you need to go clean down there.
Yeah.
The guy was about to rim him, and he was like, you're not clean down there.
Yeah, exactly.
You should clean yourself.
Exactly. And I think, and that's something as well that a lot of people who are new to sex don't realize. No one's ever told them that. No one's ever pointed that out. But it is an important part of, especially, oral anal sex is being clean down there. There's a certain amount of bacteria that are in the GI tract, obviously, E. coli and things like that. The things that we need to worry about in the gay community are there are a few entities that kind of run in the gay community that cause disease from rimming. One of those is Giardia infection. Giardia is pretty common in the gay community.
It was common with my dog.
Yeah, exactly. It's common in well water. It's common in dogs. And in gay men. Now, you have to have the infection to be able to pass it to someone. But usually someone's going to know they have Giardia because they have gas that'll blow you out of the room. Diarrhea, cramping, abdominal issues. If you're having those,
oh my God, this sounds like me. Do I have Giardia?
Boy, maybe
I'll talk to you later. I don't. I'm fine. I eat a lot of fiber. We're good.
Yeah. So not so much in the United States because it's a developed country, but in other places, parasitic infections can also be spread that way. But like I said, these things are rare. They happen. You should be aware of them. But in general, if somebody's having a problem, they're going to hopefully be able to communicate that with you and not.
One would hope. Well, what happens if you're in the heat of the moment and they're not showered and you're just like so turned on that you're going to go down there despite no matter what happens? Should you be worried? And I'm not saying I'm going to do this, but I'm just hypothetically saying.
You shouldn't be worried. I mean, go for it. Go down there, inspect the merchandise a little bit. And if things aren't clean, do what the guy did in It's a Sin and say, hey, let's go take a shower.
But do you really run a huge risk of catching anything if it's not clean down there?
It's pretty low, to be honest. It's pretty low. And one of the things I always recommend to people after doing something like that.
Great.
Oh God.
Well,
that salad dressing is not it's expired.
Some people like a little flavor.
Oh no!
You want a little dressing with that?
They're
salad?
gonna have it. Oh yeah, they're gonna have it their way for sure.
I have some corn with this.
Oh my God, that's a good question. We could ask him. He's a GI doctor about the corn. Okay, I just thought of that. Never mind.
We're gonna let you finish your answer.
Yeah, no problem. Another big important thing about after you do that as well, that decreases your risk for infection of any kind, is rinse with Listerine afterwards.
Oh my God, there we go.
Yeah.
I mean, you should be rinsing with Listerine pretty regularly anyway.
Yeah, but if a lot of guys will carry a little bottle of it around in their gym bag or just
in case they go when they're at the
so
gym.
Now I know that they don't care about their teeth. They're just ass eaters.
That's right.
Oral health? No, I'm eating some ass.
And we'll get into this later, but it's also a good thing to do after you perform oral sex as well.
Just sucking a dick.
Well,
gotcha.
yeah, that was the other thing. It's like, okay, how do you help people approach, who might be interested in oral sex? What are some tips for people to keep an eye out for when they are doing oral sex and to be safe?
And also to branch off of that, if it's too big and you vomit on them, what to do after?
I only vomit on them because you pushed my head all the way down. Okay.
That's your GI tract. You're good.
But then you just grab a bottle of Listerine and you get back to it.
That's right. Get it together, honey.
Oh my God.
Fix your wig and keep going.
Yeah.
With oral sex, I actually did a big TikTok about this yesterday, and it got a lot of response.
Yeah, I saw that. Yeah.
Inspect the merchandise. Look at it. Does it have a sore on it? If it's a hookup, does it have a sore on it? Does it look unusual? Does it smell unusual?
Oh God.
If so, get out of there.
Yeah.
Leave.
Listerine won't help you with that.
No. Yeah. In general, HIV is rarely transmitted through oral. Mm-hmm. If you have a bunch of sores in your mouth, I wouldn't do oral anyway, just because it increases your risk for STIs. With other things, gonorrhea and chlamydia can happen orally. Like I said before, Listerine afterwards actually there are scientific studies that show that it does decrease the amount of bacteria in your mouth after performing oral sex. There's a big study in Australia going on right now. So honestly, it's a harmless thing to do. Why not do it if it has any chance of decreasing your risk for gonorrhea, chlamydia?
Nobody wants that. You don't want the clap. You don't want the clam.
Okay.
You don't want any of it.
So I want to just splinter off here for a second, because you said that you had 2 kids and they're twins and they're 16. Yep. So how do they feel about you being on TikTok, which is something that they are probably on and their friends are on and everything like that, like, and having you speak this frankly about sex and especially about gay sex?
It's never come up. They never address. I'll say, oh wow, I had 160,000 followers today, and they're like, yeah, whatever, Dad, who cares?
They're like, great.
They really, honestly,
thanks.
they're in their own little world. They don't care. I don't think their friends are on my algorithm. So, honestly, I think TikTok does a lot of almost censorship of my material. Because I have 167,000 followers, but a lot of my videos only get about 5,000 to 10,000 views.
Oh. Okay.
So I think if there's anything remotely sexual, they gear it away from people under 18.
Well,
that's 4,999 more views than I get on my Instagram.
So,
and my one view is Paul.
I love you, girl. I follow you all the time.
Yes, double tap.
So in the vein of oral sex, like, how important is like grooming down there to that?
That's a great question. Anybody want to eat some pubes?
Well, yeah,
unless you want to, then go for it.
And honestly, that's a personal preference for a lot of people. A lot of guys, they love hair. And you'll find that a lot in the community. You don't shave. Don't shave that. No, I don't want to like somebody who looks like a prepubescent person. I want a hairy man. And then there are other people who are like, oh my God, hair, get that away from me. So you're going to find a mix of people when it comes to grooming as far as hair, who are into or not into that. It's like everything else in the gay community or in the community in general. You're going to find some people who like what you got and some people who don't like what you got. Mm-hmm. So just be you and don't worry about it. Make yourself happy first, and then you can worry about what everybody else thinks.
If you can't please yourself, how the hell are you going to please anybody else? Can I get an amen up in here?
Amen. I say we get to because I want to know about barebacking.
Oh, sure.
And
we have a lot of sex questions.
Yeah.
Oh,
so
sure.
I have and you're basically a poop doctor kind of. So
yeah, but I mean,
but we're going to talk about poop, everybody.
Sure. Yeah. So barebacking, huge in the gay community now because of the advent of PrEP. PrEP, there's most people know of it as a daily regimen to prevent HIV. You take it on a daily basis, and then it's really, really effective against preventing HIV. There are actually some new ways to take PrEP if you're not that active. So if you don't have a very active sex life, and especially during COVID, a lot of people have said, "Oh, I just stopped taking PrEP because I'm not having sex." But if you're one of those kinds of guys who only has sex a couple of times a month, why take a pill every single day to protect against HIV if you can plan around it? There's a new regimen that's called 211. Where you take 2 pills within 24 hours of your encounter. So, say on a Thursday night, you got a hookup that's going to happen. You take your PrEP at least 2 hours before, but preferably 24 hours before. 2 pills, and then 24 hours after you take that dose, you take another pill, and then 24 hours after that dose, or 48 hours after your first dose, you take another pill. So 2-1-1. And it's been shown to be very protective against HIV, but it's only been studied in Truvada and not Descovy. Descovy is a lower dose of the medication, so it may not get to the tissues in a high enough concentration that quickly to be able to do the 2-1-1 regimen. They're still studying that. So,
now,
but anyway,
I am not for me, it's not the 2-1-1 taking the pills or anything. It's just finding a gay who's willing to prep
to plan
out a hookup.
Right.
Hey, and we're gonna hook up in 2 days. See you then. I gotta get my 2-1-1 on.
Yeah. But some people plan hookups, but most guys, it takes away the spontaneity if you have a 2-1-1. But it also decreases your risk of kidney dysfunction and osteoporosis if you're on Truvada. So talk to your doctor about it. I'm not saying I advocate it. It's just one of those things where it's something new that's coming along. And there's actually a shot that may be available within a couple of months that you do one shot every 2 months, and that's all you need.
Wow. That's kind of interesting.
Yeah.
Okay.
Medicine is fantastic.
So we're talking about barebacking.
Yes.
Yeah.
Man, you are good at keeping on topic.
Let's get back to that.
Yeah.
He's on top of it.
Yeah. Okay.
He's on top of the topic of that.
So I was saying, because PrEP has put barebacking back in vogue, after we were damaged so heavily psychologically in the 80s and 90s by seeing all of our friends die from HIV and AIDS, it's something that most people didn't even consider for the majority of their lives. And now suddenly in the last 10 years, we have this pill that you can take on a daily basis, and you can never become HIV positive if you're pretty religious with taking it. It's 99+% effective in preventing HIV. So more and more people are barebacking. And one of the big things I want to, I'm not judging anyone who barebacks. I'm just saying that yes, PrEP prevents HIV, and it prevents it beautifully. But there are other things that happen with bareback sex that you also need to consider. And I don't judge people for doing that, but they need to be aware of the consequences of those things. So gonorrhea and chlamydia and syphilis and herpes and genital warts, all those things can still happen if you bareback on PrEP. So yeah, gonorrhea and chlamydia, pretty easily taken care of with a shot or some pills. Syphilis, usually a shot or pills can handle it pretty easily. Herpes, I think most of the gay community actually has herpes antibodies. Anyway, I've seen studies where up to 85% of the gay community has had antibodies to herpes already anyway.
Huh. I was going to say herpes are for life.
They are, yeah. So, and then the beautiful thing about prevention for HPV these days is the Gardasil vaccine is available.
Oh, that reminds me, I need my third. Thank you.
Yeah. So definitely, I mean, that prevents HPV, which causes anal cancer and cervical cancer. So, and even some oral cancers. So I tell people especially these days, most kids are getting vaccinated. Like my kids got automatically vaccinated through their doctors, boy and girl, but it's available and approved for people up to 45 years old. And a lot of people think it's just for teenagers, but you can get it up to age 45. And actually some doctors prescribe it for people over 45. It may not be covered by your insurance, but hell, it's worth an ounce of prevention. A pound of cure is definitely worth the ounce of prevention of taking an HPV vaccine.
Absolutely.
So yeah, so you need to be aware of all these things, but and if you do these things, you need to be aware that you need to get tested properly for all these STIs. So with gonorrhea and chlamydia, I always tell people, and you'd be surprised how many people don't know this, that a blood test and a urine test is not enough to check for gonorrhea and chlamydia if you suck dick or if you fuck. You need your throat swabbed.
Yep.
And you need a Q-tip up your butt to see if there's HPV. To see if there's
butt.
Honey, I don't think that you have any of these. You're good. You're in a marriage.
So that's why it's important to be a little bit more knowledgeable about these things, because a lot of doctors, like I switched doctors at one point, a long time ago, and went in to get tested, and he gave me a urine cup, and I'm like, honey, I do more than just use my front, I use everything.
Get that Q-tip up my booty hole. Thanks.
So even doctors often aren't knowledgeable about what we do. So it's important to communicate what you do.
You want to make sure that you're getting the right amount of testing because you don't want your life to be in jeopardy, really, at the end of the day.
And honestly, as well, I think after hearing all these people on my TikTok and on my Instagram privately message me and say, oh my God, I've never had a throat swab or a butt swab, and I'm 40 years old. I'm thinking, well, no wonder gonorrhea and chlamydia are rampant throughout our community. Nobody's checking for it properly.
Yep. Mm-hmm.
So the consequences of barebacking, obviously, all the STIs, A lot of it is preventable. At least HIV and HPV are preventable these days. The other stuff is generally treatable, but sometimes it's not as easy as it sounds. There are resistant strains of gonorrhea out there, like a super gonorrhea that people sometimes have to be hospitalized, get IV antibiotics for. Not to scare everybody, but it happens.
Or something.
It's a reality that we face. Yeah.
Yeah, and then with warts, I've had a guy who hasn't bottomed in 25 years, with his husband, and he had an HPV infection from an encounter 25 years ago, and he was one stage below anal cancer on an anal pap smear that I did on him. So that's another thing that a lot of guys aren't aware of, is that you should have at least one anal pap smear to check for any sort of dysplasia, which is precancer, or HPV infection, if you've ever bottomed before, bareback especially.
Okay.
So these are things that a lot of people aren't aware of, but it's all part of our healthcare that people need to be aware of. And like you said, if you're on PrEP, you got to get tested every 3 months anyway with, butt swab, throat swab, pee test, blood tests. But if you're sexually active in a non-monogamous way, you should be getting tested every 3 to 6 months for these things too.
So I have some sub questions with it.
Oh my God! Sure. Do you have Dom questions too?
I have sub and Dom.
Yes,
yes, mistress.
Sorry, our producer just fell over.
Spit. I want to know all about spit. What about it? In the act of stuff, and how does it affect both tops and bottoms?
Wait. Spit.
Using it as a lubricant.
Oh, not like spit versus swallow.
Right.
Or that works too.
Yeah, that works too.
Oh, wow. Okay.
Yeah.
So saliva for us.
Salivating on the...
Okay, so we want the salivary amylase, which is the enzyme.
Oh, he's fancy. He knows it. I love it.
She knows.
She works in biotech, gene therapy. Yeah, I don't use any of my college education. Don't go to college, kids. But if you do that, go for it. Student loan.
Yeah, spit. Personally, not a fan of it.
Okay.
It's not a great lubricant for a top or a bottom. It's good for a handy in a pinch, but honestly, it doesn't work for me. And huge turn off if somebody tries to spit on me or in my mouth. That's just not my thing.
You don't like hydration via other people's spit? Oh, I'm really thirsty. Please spit in my mouth.
I've had people try to do that before, and I'm like, honey, no, this is
maybe you should. What's the show that they go tell them to shower? What is the show? I'm Out. Inside.
No,
Out.
it's
what's the one?
It's a sin.
I'm on call. It's a sin.
Oh.
There we
I'm
go.
like, what?
The one you were talking about. Basically, just tell them to get out of there. You're not spitting in my mouth. Go away.
Yeah. So also with right now in the COVID era, not exactly the greatest thing to be doing, using spit.
But in a sexual way, what are the causes to, what kind of cause and effect will you have on someone's butthole? That
honestly, I don't worry a whole lot about any sort of infections or anything like that, but when it comes to anal sex, you want to be able to be lubricated well enough to not get torn back there. An anal fissure is very painful and can put you out of commission for months.
That's my dream.
And I've had guys who've had surgery for anal fissures, and they're out for the rest of their life. They just can't.
And then they sit on that
it.
donut because they have to sit appropriately.
Oh gosh.
Yeah.
Really?
Yeah. And you can't poop, right? Yeah.
Yeah. So lubrication when it comes to all that. And spit isn't the greatest.
Okay, good.
Okay. And what would you say is best lubrication for people?
Silicone or water-based?
Well, I personally prefer silicone, but it makes a hell of a mess.
I was just going to say it gets everywhere.
Yeah, you have to, one of the things that is a helpful tip that I was surprised got, a couple of 100,000 hits on TikTok was I said, hey, a little helpful tip about cleaning up externally after you use silicone lube, have a little tiny bottle of Dawn dishwashing liquid in your shower.
Oh,
yep.
It cuts it right off. I mean,
it's like a little bird in a oil spill.
Or you can use Neutrogena body oil.
I mean, it's
because it's oil. It's silicone. It's not water soluble, so you need something oil based to remove it. I
exactly.
hate silicone.
Or oily hair shampoo or things like that. They tend to really work really well. So I prefer the silicone-based lubes because they also protect, kind of form like a protective barrier. If you have any issues with hemorrhoids, or if you have any discomfort back there, or if you have a history of fissures or anything like that, it's just really good lubrication. It doesn't get absorbed like water-based lube. Water-based lube, after about 10, 15 minutes, starts absorbing the rectum starts absorbing all the water out of the lube, and it becomes kind of gummy and sticky, and you have to reapply.
That's when you know it's time to be done.
Yeah, really. Yeah.
If you haven't gotten off in that amount of time, then the session's over.
Lube is not like chapstick. You shouldn't just have to reapply.
It's not sunscreen either. But like that's my thing with silicone, because it's like, it lasts a long time, but like water-based, you might need a lot of it, but like at least it washes off. Like silicone-based lube I've had on me for like the entirety of the day, and then it like oh my god, this is maybe TMI, but it like bled through my shorts, like onto my pants, because it like it didn't like leak out of me. But there was you got to use a lot of lube when you're using booty stuff.
I mean, some guys like to have it on them the rest of the day.
No, I did shower. The thing is, a silicone-based lube just sticks on you. It's like it becomes a part of you.
Yeah.
It's a part of your world.
Yeah, that's how you need.
It's aerial.
That's why you need to know how to get it off properly. But another thing about lube that I want to make sure that people understand: there are certain lubes that are not compatible with latex condoms. Mm-hmm. So silicone-based lubes and water-based lubes and the hybrids of the two completely compatible with latex. You don't have to worry about that. But if you're using condoms, don't use coconut oil or petroleum jelly or baby oil. It will eat through the condom and make it break a lot easier.
That's a good point. I was just going to say that because people think like natural is better sometimes. So what would you say in terms of like coconut oil or petroleum jelly, like Vaseline and stuff like that? Obviously, you just said that's a no-no with condoms.
That's a no-no if you're using condoms. No.
So can you use that without condoms?
Yeah, absolutely. Okay. And I think coconut oil is probably better than Vaseline and baby oil for sure. But yeah, so and actually, I kind of like coconut oil, but you just can't use it with condoms. It leaves you smelling
nice too.
Yeah.
Oh, I'm farting coconuts. Wow, it's so tropical. And then when someone goes down to eat your butthole and toss your salad, it's very tropical for them.
Like a margarita.
It's like they went to like Hawaii. They're like, oh wow, look at your booty hole, nice and coconutty.
Actually, one of the drag queens on RuPaul's Drag Race. Apparently made some sort of TikTok or some sort of Instagram where they recommended squirting Listerine in their butt to make it better for oral anal. But I beg people, please, I think it was Vanjie. But I'm like, please don't do that.
No.
Especially not undiluted. Now, diluted a lot, maybe it's okay, but don't do that at all because it could really burn your butt really bad.
Yeah, no, that's for your mouth.
Well, and since we're talking about like, you know, how it smells and spitting in Listerine and stuff like that into your butthole, I know you did a whole thing about douching.
I'm glad you bring this up.
The importance of it, and is there too much douching, and like just the stigma around people who have this idea that poop on the dick is not.
It's doo-doo on the D. Yeah,
right.
I mean, it's your butthole.
Yeah,
it's fine.
Honestly,
I'm not shitting on you.
Or I am. You want
that? Hey, and there are some people that do. So you know, you have to be careful. So with this idea of cleaning out, some guys don't need to. Some guys are able to have a good diet with lots of fiber or take a fiber supplement daily, and they can get away without doing that. They know when there are bullets in the chamber, and if there's bullets in the chamber, they don't play.
I love that. Bullets
you got a loaded gun, girl.
Bitch, you need to fire off. Okay.
Personally, to use a Cardi B reference, I like a clean garage back there if I'm going to be in there,
I don't know Cardi B, but I'm going to go for it. Is that a WAP?
Yeah. That's part of
pussy.
Yeah, that's part of the WAP song is, talking about parking that Big Mac truck in this tiny little garage.
Oh my God.
Yeah. So
is
anyway,
the truck the penis?
yes, it is.
Okay. Thanks, Cardi B.
So anyway, I think personally on bottoming, I think it's a lot more comfortable to have nothing in there because you don't have anything that's getting jammed up against your rectum. You don't have a turd that's getting pushed up against you. So it's more comfortable. Also, smell wise, it's a big turn off for a lot of people when they're having anal sex, and there's a lot of smell. It is a normal thing. That's what your butthole does. It expels shit. So it's going to smell like shit sometimes. Yes, you're going to get a little shit on your dick sometimes. That's just part of anal sex. Mm-hmm. But there are ways around it, and a lot of guys prefer to douche, and there's actually nothing wrong with it. A lot of people are so upset about, it's going to throw off the microbiome in your rectum. There are billions and trillions of bacteria in your colon with the next shit you take that's going to replace all that. So I don't get too freaked out about the microbiome of that. I've never had a case of a guy who came into my office as a butt doctor who I was like, he douched too much.
Famous last words.
So people shouldn't get too bent out of shape about that. Now, if you're doing it to the point where it's affecting your daily bowel habits, there's a problem. But I recommend not to use harsh chemicals. If you're going to use anything, use lukewarm water so it's not too hot, not too cold, and don't use the chemicals that are in those over-the-counter enema bottles because a lot of them contain harsh chemical irritants that can, number one, cause cramping, and number two, cause inflammation in your rectum, which increases your risk for STIs, especially if you're barebacking. So lukewarm water. Be careful on how much you use because the colon's a twisty, turny organ with the first 8 to 10 inches is a straight shot, but then there's a big turn. So if you put too much water up in there, it's going to go over that turn, and you're going to be right in the middle of sex, and there's going to have a flood. So I tell people use only how much you need. And when you think you've got it all out of you, get up, walk around, shake it around a little bit, sit back down because you might be surprised there's going to be some fluid still there.
Oh my!
It might come through your shorts.
Yeah, I douche with silicone-based lube. Don't do that. For
our listeners out there, it just so happens that you are with someone and they are not as clean as they thought they were. Let's not shame them.
Yeah, absolutely. I agree. Yeah, and that's one of the things that a lot of people have so much emotional baggage about bottoming. They're so terrified there's going to be an accident. Mm-hmm. They're so terrified of being shamed or made to feel less than. Hey, that's a normal part of our lives, and you take a little towel, you clean up, and you keep going. Or they may want to go to the restroom for a minute and clean up and then come back.
Yep,
that's okay. It's normal. It's natural. It's human.
Yep, everybody
do not shame people for having that issue.
And let me tell you, you wouldn't even be in this situation if there wasn't a bottom anyway. So you better be glad that there's somebody who was willing to let you fuck them.
Absolutely.
Yeah. Honestly, that's a huge sacrifice that bottoms go
it's
through.
It's an honor for you to come into this body.
It is. It really is.
You want to park this truck in this garage?
Yeah. What's the truck? Mack truck? Yeah. Mack truck person.
So, how much would you say is too much bottoming? Positions that make it or
I hope he says there's
not
such thing as too much bottoming.
Yeah, it's like
the number doesn't exist.
The limit does not exist.
The limit does not exist. It's like is there too much masturbation? If you're bottoming to the point where you can't do anything else but bottom, then that's the only time it's a problem. Mm-hmm. If you're hurt, if you have an injury back there, then you might want to rest a little bit. But theoretically, there's no certain number that it's okay. You can do 8 times a week, but not 9. So
I guess
do
just
what's
listen
good for
to
you.
your body. Right?
Yeah, listen to your body. Yeah, and that being said as well, as far as positions that make it easier to bottom, like you had mentioned as well. I tell people, especially new bottoms or people who've been hurt before, to start off on top because you control how fast it goes in, how deep it goes in at your pace to where you're comfortable. And once you get it all in there and you take a deep breath and you can relax a little bit, then you can either stay in control, which is pretty hot, or you can have the top take over and be in control. So it's an injury preventer. It's a couple of minutes of just getting your body and your mind ready. Because those first couple of minutes of bottoming, honey, they can be pretty harrowing depending on the size of the task you're about to take. You know? If it's a little dick, no big deal. But if it's a big fat dick, it's going to take some time.
If it's a little hill, Kilimanjaro, you might need to take some time and work up to that.
Get your Sherpa. You're good. Pack your backpack. Make sure you got your silicone-based lube, your condoms, everything you need.
Another important thing to bring up about that too, though, is when it comes to positions in anal sex, everybody's curves are different. So,
yes. Oh, I'm glad you said that.
Yeah.
Know your body.
Everybody, and like if you have a different partner, then every day even.
And we're not judging.
Everybody's dick's going to be curved differently. Everybody, some point up, some point down, some go to the left, some go to the right. Your own body has its own curve. So find what fits. Yeah, that's what find what fits your situation and make that work. One crucial tip that people don't realize about bottoming and has revolutionized a lot of people's sex lives. I even have it on my Instagram as an IGTV video. There's this little exercise that I recommend guys do and incorporate as part of foreplay.
Is it the exhaustion of your butthole and then the muscle exhaustion to where it relaxes? Where you hold it for...
Yeah,
Okay.
It's similar to that. It's called... Well, I call it the butt clock. So think of your hole as a circle.
Uh-huh.
Lubricate your finger and slide it in about an inch or two and keep it firmly straight, and then press over to the side, up or down. So like 3 o'clock, 6 o'clock, 9 o'clock, or 12 o'clock, and keep that pressure pressed at that position. That tiny little circle starts opening up and relaxing.
Oh.
And it's a trick that doctors use to be able to examine people's prostates and rectums who are really super tight. But you can incorporate this into bottoming and make it so much better an experience to get relaxed for penetration. So stick your finger in, press it over to the side, hold that pressure there, release and go over to the other side, go up or down, the 3, 6, or 9 positions, depending on your time zone. And, and it really does a great job of relaxing you. And I have so many people who have privately messaged me on Instagram or on TikTok who said, "Oh my God, my husband loves you. Thank you so much. Oh my God, you've revolutionized our sex lives. Thank you. Thank you. Thank you." And there's nothing more rewarding than hearing that from somebody.
Yeah, so I have kind of like a 2-part follow-up question that I was going to ask about healthy bottoming. But then after you kind of just talked about the, finger butthole to make it open up, can you kind of discuss and go like a little bit into detail about how, being in the moment and turned on is kind of critical to have good anal sex?
Being in the moment and being turned on is being...
Does that make sense? Like if you're not into it, but you're trying to like make it work. Have you ever had that?
Well, yeah. And that's a two-way street as well. It's if the bottom's just not enjoying it, it's not worth doing. Or if the tops just can't make it happen, there are times when you just can't make it happen.
Yeah.
It takes a certain degree of erection to be able to penetrate a butthole.
Yeah.
And not everybody's able to achieve that. Like you go out and you drink too much, might not be easy to be able to penetrate someone because there's a certain degree of firmness that is required.
So, what would you give like some tips and stuff for people who are uncircumcised, and some of the care, and especially for people who might have never seen one before? How can they see if everything is okay down there before they tackle that? You know what I mean?
Tackle.
Because I'm like, I don't want you to pull the skin back and something fall out, and they're like, "What is that? Is that a treat?
Those are just the critters that live in the
prize
foreskin
at the bottom of the cereal box?"
And honestly, I think that's something that happens a lot, especially down here in San Diego, where there are a lot of uncut guys that some people just aren't used to, but they need a little bit of education on. And it's okay if you're uncircumcised and you have a guy who's not really familiar with how to manage it, to teach him. It's okay to teach somebody how to suck your dick right, or to handle it right, or, oh, no, don't pull back too fast because I'm super sensitive on the head and, I don't like that. Communicate what you like. As far as self-care, obviously pulling back the skin and keeping it clean on a daily basis is important so you don't get buildup of material called smegma. But as far as preferences go, I don't think anybody should run away from one if it's uncut, or, I think it's hot. I think it takes a certain degree for someone who's not used to managing sex with an uncut person. It takes a few sessions to kind of figure it out, but it's okay to ask.
Okay.
What do you guys think about that? How do you approach it?
I have, had my share of these kind of things, and I do enjoy it on occasion. But yes, I have had someone who was not clean down there, and I was like, did not know to look for something like that beforehand, and I was like, what is that in my mouth? Do you have any crackers? Because you just gave me cheese.
Oh no, Paul!
Oh.
It was crusty.
It was kind of.
Was it like Captain Crunch? Oh, that was not Captain Crunch berries. Oh my god, that was. Oh, you know what? It was Captain Crunch berries with the powdered milk because it was hard.
So anyway.
I love Captain Crunch, but I'm never going to think about it the same.
Aw.
Captain Crunch destroys the roof of your mouth, and so did that guy Schmegma.
But that was my experience with it. So.
Oh my gosh. I appreciate penis.
Penis?
No, uncut penis. I think that, all of God's children are beautiful. But if you're gonna, put it inside my butthole, absolutely, that's fine. But I think maybe it's not enough experience with uncut penises for me.
Oh, honey, you're missing out. Most people know how to clean their penis, so don't let that really.
No, it's not even that at all. Yeah, I think I've had a couple experiences, and I always get really scared from me that I'm going to hurt them, right? Because it's so much more sensitive.
Well, and that's where the whole communication thing comes in. Hey, does this feel good for you? If it doesn't, let me know so I know how to do it right. But that's not exactly, hot or sexy in the middle of a sex session for sure. Yeah. But it's a good way to learn.
Communication is key. It's important. I'd have that really conversation. Is. Hey, are you okay right now?
Yeah.
Do you want to talk about your childhood traumas while we can confirm if this is hurting you? Okay, my next question is kind of around experimentation. That's a very general. Like experimenting, I'm saying in general, like what kind of tips would you give?
Yeah, I think one of the most important things for people to realize for the male anatomy is that our G-spot is inside our rectum where the prostate is. So you have to, first of all, examine why you're keeping it as a taboo or why you're nervous about it and explore that. But it's definitely a huge, and one of the things that drives me crazy about men who are so toxically masculine that they can't do anything but top, or straight guys who think, oh, if somebody goes in my butt, it's going to make me gay. Butt stuff has no sexuality, gender, or effect on your masculinity or femininity. We all have one. And especially guys with the prostate, I'm telling you, honey, I didn't know what heaven was until somebody was fingering my prostate while they were sucking my dick at the same time. There is nothing better than that G-spot getting hit. I mean, it will send you to heaven. So it's
Cue Firework by Katy Perry.
Absolutely. So you have to explore your body. It's okay to explore your body. There's no reason to keep it taboo. If you don't like it, fine. That's okay. But every good top needs to bottom at least once, so they know what they're doing, and they know how their bottom should feel or what feels badly. Listen, we get a short time on this earth. If you're interested in doing something, give it a try. As long as you're not hurting yourself or anyone else, go for it.
So for me, I have a question about like things that monogamous couples should be concerned with in terms of their sexual health, because you had a TikTok on your Instagram about making sure to wash or like rinse off your penis like after you've had unprotected sex, like because there's like bacteria and stuff that could get inside
yeah, exactly. And most married guys and a lot of guys who are not married have unprotected sex. One of the big things that you should do after penetrating someone is go urinate, because the urethra can have bacteria that get from your rectum that are naturally and normally there, that can crawl up into the rectum there and create a urinary tract infection. And urinary tract infections are no fun. Burning, stinging, difficult to pee. You can even get prostatitis, which is a deeper infection of the prostate gland with E. coli bacteria, and your prostate can almost get so swollen from that infection that you can't urinate at all. And like I had it one time, and I almost had to go to the emergency room to get a catheter because I couldn't pee. So something as simple as getting up and going, take a piss after you have sex. So easy to do.
So maybe just stay hydrated so you'll have to pee.
Yeah. A lot of people are like, oh, I can't pee after sex because I don't need to pee. I'm like, well, hydrate yourself and pee when you can.
Mm-hmm. It's like the 2-1-1. Make sure that you're planning a little bit. Just drink some water.
Go.
Yeah.
So what is, because this is going to go a little off topic of the butt thing, but
that's okay.
I think this was like Joe's question that he had. What is the best or worst experience you've had with a doctor that you can share that doesn't violate HIPAA?
I think I voted for worst. Like, tell me a really bad horror story of like someone shitting on you at the doctor's office, or like you had your fist up somebody and they like ejaculated because they were turned on, or like maybe a woman had something after giving birth. I mean, I just imagined a lot of poop all over your office.
Oh no, I have so many stories. I don't know where to begin.
The worst. Find the worst one. That's why. Let's do that one. We're sitting down. Don't worry. You can tell us.
Okay. So the worst one. Okay. So I get called by the emergency room. Okay. Oh, we've got this guy who's having some bleeding rectally, and we did a CAT scan on him, and he's having some pain. And on the CAT scan, right about 10 inches in, there's some inflammation. And so we think he's got some colitis, and he needs a colonoscopy. So we're going to go ahead and prepare him for a colonoscopy. We're going to give him the drink to clean out, the Go Lightly stuff to clean out. And you can come by and see him later and plan to do a colonoscopy tomorrow. So I'm like, okay, sure. I mean, I usually talk to people first, but that's fine. So I go into the room and I see this guy, and his whole family's in there, including his wife and 2 kids. And this dude looks really nervous. I mean, really nervous. And I say, okay, sir, I'm Dr. Carlton, and we're going to do a colonoscopy on you tomorrow. This is what you can expect. Okay, doc, sounds good. Cutting off any sort of questions I had. So we get him downstairs the next day away from his family, and he says, whatever you find, you tell me. You don't tell my wife. And okay, automatically my ears.
Oh my God,
okay,
he put
girl.
something. It's a toy train.
No, I'm like, okay, what did he do? Did
you ask him?
And so he said, just so you know, I did a lot of cocaine on Monday.
Oh.
And I'm like, okay, well, all right.
Up his butt?
But he wouldn't elaborate. Okay. So we get the camera in, we go up and around the whole colon, we're coming back out. And just as we get on the way out, I can see a view that I didn't see going in over to the left. And there's this big gash in his colon that's obviously been there about 4 or 5 days. This is on a Friday or a Saturday. So it had happened on Monday when he did a lot of cocaine. There's this big gash that's healing pretty nicely, but I'm like, oh shit, did I do that? Or is that, no, that's been there for 4 or 5 days because it's ulcerated and it's obviously healing. And I didn't have any trauma going in. And then I whispered down into his ear, okay, what did you stick up your ass on Monday? And he said, well, my wife was out of town and I went to a hotel.
He was awake?
Well,
are you awake during a colonoscopy?
No. He's. This was back when we used stuff that knocks you out a little bit more. This is about 2 years ago.
We used Starlight. He was in like
we used
Starlight
conscious sedation. Phase. Yeah, so he was kind of in twilight, and I whispered into his ear, "What did you stick up your ass?" And he goes, "Well, I did a lot of cocaine on Monday, and I was in a hotel room, and I got a little crazy." And he still wouldn't elaborate on what exactly happened, but I said, "Well, okay, well, we need to do a CT scan again to make sure I didn't actually tear that, because if you had told me that, I would have never stuck a camera in there because it could have perforated you." Mm-hmm. And I called the surgeon right away and said, hey, I got this guy who has a rip in his colon. I don't think it's perforated completely, so he doesn't need surgery, but I want you to be on board just in case. And I said, it's a married guy who did a bunch of cocaine while his wife away. And he goes, why is it always a married guy who, when his wife was away? So, yeah, there's all kinds of stories about guys.
Did you ever find out what it was that was in there?
Listen, as soon as he woke up, he was gone. He was like, no.
I want to know. Can we find him? I know that's like patient confidentiality.
Okay. So then I have a question for you then. What is the craziest thing that you found inside
that you pulled out? Okay, good.
You pulled out.
It's mainly on the other end that I pull out things. Usually I let surgery do the rectal things, but I've had people swallow razor blades. I pulled a toothbrush out of somebody's stomach.
Oh my God.
I pulled
how do you eat a toothbrush?
Pieces of light bulb.
What?
Batteries.
Oh,
maybe they were trying to get energy.
They were trying to recharge.
Really.
They probably did that on vacation.
There's a psychological disturbance where people swallow things, or they have paranoid schizophrenia, and they say the voices tell them to swallow their toothbrush, and they do it.
What's that show, My Strange Addiction?
Yes,
where people eat like
pica,
like wall, like insulation and stuff,
or their husband's ashes. Yeah, that's the one I remember.
So and that it gets pretty annoying after their third visit with a toothbrush in their stomach. Okay, it's like, okay, Herb, why are you doing that? It's 2:00 in the morning. I don't want to do this.
A toothbrush, but your stomach is small. How does it just get stuck in the esophagus too?
Well, no, it somehow these people get it down their esophagus and into their stomach, and it can't move out of the stomach because it's too big.
Oh my God!
So it just sits there, and you can't leave it there, so you have to pull it out.
Obviously. Oh my God.
So should we be worried about like when we swallow like cum and stuff like that? Are there like concerns about that? But like, is it gum?
Nothing.
Oh, it's acid will kill it. It's just gelatinous collagen. We're good. Or not collagen.
The stomach acid really chews it up.
It's just, you're fine.
So I just want to make sure it wasn't like gum or it sits in my stomach for 7 years.
Yeah, no, you poop it out. It's fine.
Yeah.
Oh, that's a good question for you, right? If you swallow gum, is that true? Does it stay in your system for 7 years, or is it just processed through slower?
It gets pretty dissolved. I mean, I've never seen gum in anyone's colon or anybody's stomach or anything like that. And so, I mean, there's all these rumors that you have 27 pounds of undigested red meat in your colon. No, you don't. It's just not. It just doesn't work like that.
Thing.
I still have kind of an irrational fear as an adult, and that's maybe why I don't like watermelon. But like of getting watermelon seeds stuck in my stomach, and then it grows a tree because of the episode on Rugrats.
That's really funny.
But I also don't like watermelon, so it's fine.
All right. So we're going to wrap up here. We do have our quick fire questions with you, Dr. Carlton. But before we do that, we just want to say thank you for being on here and helping to educate us a little bit more and stuff. And how can people find you on social medias? Well,
my two biggest social media outlets right now are TikTok and Instagram, and they both have the same handle, at DOCTOR. CARLTON, Dr. Carlton, all spelled out.
I'm going to follow you.
And then my Twitter handle was sadly taken already, so it's Dr._Carlton. And then I have drcarlton.net that we're building right now to try to put all my different podcast appearances on, and maybe some informational things, some YouTube stuff, and eventually, hopefully, some merchandise.
Well, and if people want to be a patient of yours, where can they find you?
Yeah, well, if you
asking for a friend.
Yeah, if you contact
I'm going to book an appointment with you.
If you contact me on my social media, I'd be more than happy to help you with those sorts of things. I'm really responsive on my social media questions, especially Instagram. If somebody asks me a question, I'm going to answer it.
Wow, that's dedication.
So and it does take a lot of time, but when you have people who are in, like I mentioned earlier, countries where it's illegal to be gay and they don't have any other access to LGBTQ healthcare, you got to do things like that.
He's a philanthropist.
Yes.
Is that what it is, right?
She is all out there just giving it up. Okay.
Bye-bye social life. You don't need that.
So on any of these social medias, are you doing the Carlton?
I actually have a Carlton dance with Carlton.
Oh my God! Stop it!
Yeah.
Oh my God!
But,
Okay.
yeah, it's a
I
duet.
need to watch this.
Oh, it's bad because I can't dance with the shit. So yeah,
I'll be the
But,
judge
yeah.
of that later.
All right, so we're gonna go into our quick fire questions for you. We have 3 of them. Okay.
Ooh,
So just
okay.
whatever comes to into your brain right away. All right.
Okay.
You ready?
All right.
What is your Real Housewife tagline? Do you ever watch The Real Housewives?
Yeah, I know what you're talking about. Let me think.
Okay.
Just because he looks innocent doesn't mean he is.
Oh, would you be
okay.
holding your apple or your orange? Which season would you be from?
A peach.
Or your snow from Salt Lake City?
What would it be from?
It'd be a pile of shit. He'd hold a pile of shit. Or like, here's your silicone-based lube.
Right.
Here's that unidentified object from a herb.
Right. So the second question is, what would be your weapon of choice during a zombie apocalypse?
A machete.
Oh,
Okay. All right.
okay. All right, and the final one is, what is your favorite signature drag queen dance move?
Oh, the death drop, honey.
Ugh, I knew
Oh,
that.
shablam. Okay.
I like the shablam. Absolutely.
She loves a shablam.
You don't like the boom cat cat, boom kitty cat cat, boom cat cat?
Well, I love
And then
that,
they do the little whatever this is.
But there's nothing better than a shablam.
That's true.
And now I know you mentioned that you saw one of the Drag Race girls saying something about Listerine and stuff like that. Are you a Drag Race fan?
Oh, I'm a huge fan. And not only of the US version, but the UK version. I soak up every episode I can.
So who's your favorite on UK?
You know, it started off as Lawrence Chaney, but now I'm really into Bimini Bombulash.
Yes.
Okay, but because she had like the best line in that in UK HUD.
Yeah.
Where she was like, I need to give these girls a pillow because they're sleeping on me. I'm like, bitch, that is some Nicki Minaj Cardi B shit
I
right
do
there.
love Lawrence Chaney.
I love Lawrence Chaney. The thing I can't get over on UK,
Charles.
the thing I can't get over on the UK Drag Race is how horrible their haircuts are in real life.
I know.
Like, is that a
Oh my
COVID
God.
thing? Why is their hair so bad?
I think it's
because
a
that one dude has a
UK
bowl
thing.
cut, and I'm like, dude.
There were two. There were two with bowl cuts, and then Bimini Bombulash has like the
yeah.
But yeah.
It's like their hair is fried too.
I don't
Just
know,
like-
and it's like long but mullety, but like shaved on the sides. I don't know.
I know.
Okay,
yeah, I'm like, what is going on here?
It's a decision.
And who's your favorite in the US?
Choices. My favorite currently in season 13 or overall?
13.
13.
Oof. You know, I was a big Simone fan for a little while, but she's kind of slacked off a little bit, and I'm really liking Denali.
Oh.
Okay.
My thing on Simone is that when you start high, you can only go down. So she's destined for some. Blah, blah, blah.
Okay. Well,
Okay.
thank you, Dr. Carlton.
All right,
We
thank
really
you.
appreciate you being on here with us, and we
All right.
appreciate it.
Yeah.
And have a great night.
Thank you so much. Have a great night.
Bye.
Bye-bye.
Special thanks to Andrew Smith and Nick Stone for producing the show. If you like us, please follow us at tugayspod on Instagram and visit us online at tugayspod.com. You can find us anywhere you can stream podcasts. Don't forget to like, subscribe, and let us know topics you'd like to hear. And always remember, stay safe, stay classy, stay sassy, and always stay a little bit trashy. See you next week.